Hey, how's it going everybody? Brian Saladay here, and I'm a personal trainer and licensed physical therapy assistant. Today I wanted to discuss with you how to correctly ice an injury. So let's get started here. So, one of the things you want to make sure to do if it's you just took a bag of ice, a Ziploc bag, and you filled it with a bunch of ice, and you set it on you want to make sure you don't set it directly on your skin. So you want to get a light towel, something not too thick that diminishes the cold, but enough that it's not just strictly just sitting right on your skin. Another thing you want to make sure to consider when icing a body part, shoulder, knee, back, anything, is there's a little bit of discussion on whether you want to use a gel ice pack or a bag of ice. And it really kind of depends on you and your convenience. And what I mean by this is gel packs are a little more convenient because they don't, after a few times, they don't get little holes in them, they don't tear. They're easy, just take them out of the freezer, you put them on you take them off, you're good to go, right? The problem with gel packs is they don't get as cold as just a bag of ice. They don't get as cold, number one. So you don't get as much of benefit because it doesn't take as much of the swelling out. Number two is they don't engulf the joint. They don't engulf the joint because like a bag of ice, it'll sit and it'll just kind of sit and it'll kind of constrict around it. Where the gel pack will just kind of lay on it and it'll kind of fold a little bit. So it's not as good. You're not getting the overall effect as good. So the gel pack is a little more for a convenience factor. Say you're traveling or something like that. It's going to be a little easier. The benefits with ice, like I said, it surrounds the joint. It gets colder. The negatives are that the bags do leak. You do have to fill them. It's not that big of a deal, but you do have to fill them. Some people, if they don't have they don't have a lot of. Let's say they just have ice trays. You know, you got to empty the whole ice tray to get enough big of a bag of ice to work your knee or your shoulder or whatever. So that's something to consider as well. You also want to make sure to ice it for no more than 20 minutes at one time, and do this 2 to 3 times a day. That's a great start for icing for an injury. Also, remember to elevate the body part, especially if a knee. Obviously, if it's a shoulder, that's a little more difficult. You can't do it. You just kind of raise it up a little bit. But the purpose of that is you want to get swelling out of that and towards your heart, and that's why you want to elevate it. It's just to get the swelling out because it's just like gravity. Blood will go where gravity's going. I hope this information helps, guys. Come check out my website, StandardHealthLLC.com, and check out my YouTube channel, Standard Health LLC. I hope this information helps, guys. Have a great day. Click the share button for me, or let me know if you have any more questions. Just send me a message. Have a great one.